honored to be with you today. My name is Marcus. I work and I live on the Anishinaabe Algonquin territory. I am grateful for our Indigenous siblings and elders who have been given us this land to work and live on. And as an Indigenous person of Egypt, I work from an anti-oppression, anti-racist perspective to hopefully get rights to our siblings, the Indigenous people here in Ottawa and all over Canada. Today, my presentation, I work for the Ottawa Newcomer Health Centre, and one of the things that we do is help folks get access to health services. And one of the services that we help folks to get access to is mental health services. Sometimes it's really tricky, and I think actually it's not sometimes, most of the time it's tricky to get services that are mental health. So I'm just gonna share my my screen here. So yeah, and my presentation today would be around, so I am a person who live in Ottawa or the province in Ontario, or maybe in Canada, and I decided to get access to health services. Now what are the resources? Like, how can I access these services? I am past the thing that, like, mental health services are really important, and I know all these things, but once a person is deciding I need to get access, now what? How can I get access to these services? Okay, is there any person here who would like to share their experience of accessing their service, the mental health services? Have they decided to get, or have they have experience with accessing mental health services? If you want to speak up, maybe raise your hand or just type in the chat. Also, I speak Arabic. أنا بحكي عربي. لو حد عاوز يتكلم بالعربي اتفضلوا، ممكن ترفعوا ايديكم تكتبوا لنا في الشات. طيب, so now what? From my own experience, actually, it started, yes, I have been working with the Ottawa Newcomer Health Centre for almost over 4 years now, and I know accessing mental health services, and I tell folks how to access mental health services, but it started with my own experience. I wanted to access working with folks living with lots of trauma and mental health issues can be overwhelming for folks who work in the community like us. So I wanted to access health services myself, and the first thing that I did is, number one, I discussed this with my primary healthcare provider, and this is usually the way it goes. You go to your family doctor and you tell them, you know what, I feel maybe overwhelmed mentally, or I need to access or have a mental health provider. Can you help me? Can you coach me in the direction or in any direction? And the second thing that I did is I checked my coverage. And I'm going to get to the next point, which is coverage. What is coverage, and what are the coverages or the plans that cover mental health services? Okay, so there are different kinds of coverage, or different people with different coverages. There is the publicly funded coverages, either provincially or federally. There is somebody who is employed with a coverage, and there is somebody who unfortunately doesn't have a publicly funded coverage or employed or their employer doesn't have coverage for mental health services, so they buy their own plans. So they buy coverage out of pocket, what is called, and then somebody maybe, for example, as a student, so they do have what is called UHIP, and at the end there is the no coverage, people with no coverage at all. First, the publicly funded. So there is the provincial, like here in Ontario, we have the green card, the OHIP card. This is the provincial health coverage. And some people also have the federally funded coverages. In Ontario, OHIP covers the family doctor's visits and also covers for psychiatrists. But in order to be referred to as psychiatrist, you need a family doctor referral. I'm going to get into more details about these things, and please share your thoughts in the chat or raise your hands if you have any questions. Another way of the provincially funded mental health services could be accessed through somebody is on ODSP or on Ontario Works. For the federally funded program or coverage, it's called a mini IFHP program, the Interim Federal Health Program, and that covers psychology or services by psychologists, psychotherapy, psychiatrists. All these services are covered. Okay. An example for if somebody is employed and their employer has a coverage or a plan, that's called group benefit. And examples for it are companies like Green Shield, Blue Cross, etc. Out-of-pocket plan, as I mentioned, somebody, you go to an insurance broker and you buy from them health, dental and health plan. This is called individual or family plan. And again, if you are a student at, for example, Carleton, Ottawa U, you would be getting a UHIP coverage. In addition to, if you are a resident of Ontario, you would get OHIP. But if you are not, if you're an international student or something, you just get UHIP coverage. But UHIP also cover mental health services. And we know that also we still have many people around us who do not have a coverage for mental health services at all. Okay, we shift to providers. Many people who I myself, before starting working as a multicultural health navigator at the Ottawa Newcomer Health Centre, I did not know exactly the differences between providers, health providers who provide mental health services. And this is really important because if you called your coverage facilitator or the company that covers you and you ask them, what are the mental health services I am covered for, they will tell you names of providers, like the titles of providers. Not necessarily, and if you don't know the differences, it can be tricky to access them. So first part, you decided that I need to access the mental health services. I talked with my primary care provider to access it and maybe get a referral. And I checked with my health insurance or what I'm covered for. Now I need to understand who are the mental health providers, what are their names. So I did these two categories just to simplify the route for accessing mental health services. Mental health services can be provided, or providers can be categorized in two simple categories. One, medically focused, and the second is counseling. What I mean also by medically focused is the fact that a provider who is a physician or a nurse practitioner, maybe, or somebody who's trained medically, who would be able to diagnose a mental health condition and prescribe medication. That's the medical part of the providers. The second part of the providers is counseling. Counseling are those providers who maybe listen and start the route of mental health therapy with you, not necessarily diagnose a medical condition or prescribe medications. Sometimes they work together, sometimes they talk to each other, but they have different names and they work differently. So if we would think of the medical providers, first is the primary care provider. Primary care providers are either family doctor or a nurse practitioner. Many of us don't know that family doctor can provide mental health care or primary mental health care. So this would be your first gate. If you are feeling overwhelmed, or if you have decided that I need to talk about my mental health further, your family doctor has a primary training or has a training in mental health. They can help you with your mental health. So ask them for help, because you already have access to them. If you have, since most people residing in Ontario have access to, or they can access family doctors or nurse practitioners. The second part is psychiatrists. Psychiatrists are specialists, physicians who are specialists, and we know that in order to access specialists in Ontario or in Canada, you need a referral from your primary health care provider. So maybe you talk to your family doctor, your nurse practitioner, and then you need to discuss more your mental health condition, or you need to get a diagnosis, or maybe you need to get prescription for a mental health condition. You can ask, or your family doctor might be able to, or will be able to refer you to a psychiatrist if needed. But of course, heads up, we know that we have shortage in psychiatrists, and there is a long wait time to access psychiatrists. Some of the comments that I would add throughout this presentation is because of my background as a mental health navigator. I work on a daily basis with folks who want to, or who can't access health services. So a comment like a long wait time for psychiatrists might not be familiar with many folks, but this is what we see on a daily basis. Okay, back to the second part of the providers, which is the counseling. Mental health providers that provide counseling are psychologists, psychotherapists, and clinical social worker. It's really important to familiarize yourself with these terms. First, psychologists. Those are usually people who studied up until PhD level. Psychotherapists, those are providers who studied up until master's degree. And clinical social workers are social workers who got an additional training in mental health to provide counseling. So those are the three main categories that are covered, or either whatever the plan that you are in, if you have a plan, the company or the body that runs your coverage will tell you you are covered for a psychologist and psychotherapist, for example, for up to $500 per year. For example, I'm just giving certain example. Or you are covered just for psychologists for 10 sessions per year, or something to that effect. So these are the details that when you call your insurance provider, they would tell you how much you are covered for and for how long. Okay, moving on. The last part is the routes. What are the routes that you can imagine a person who is in need, or who decide? Because we know that maybe many of us learn a lot about mental health, but the decision to access mental health services is a key. You're giving a consent to access mental health services. So once you access this, we can imagine certain routes. Once you decide this, we can imagine certain routes that a person would be taking in order to access or to have these services, either on the short on the long run. So the routes that I imagined for different scenarios for folks. If somebody is in a crisis, there are what is called crisis lines. What I mean by crisis, mental health crisis, is, for example, people who cannot, like, they got really overwhelmed mentally for certain events that are happening within their households, their families, or even around them, and they really can't function. They would identify this: I am in a crisis mode, I can't do anything, or I need help immediately. But I don't really need to go to the hospital, because if you are in an emergency mode, you need to call 911 right away. But this is different than just being like in a mental health crisis. It can be different, like it is different than calling 911. Of course, 911 folks are trained to deal with mental health crisis, especially folks from the ambulance. When we call 911, you are being asked fire, ambulance, or police, and then you'd be like calling or asking or requesting an ambulance. But this is for emergency situation. If you are in a crisis mode, there are crisis lines. What our crisis lines are like phone call, like phone numbers that you'll be calling, and you would get connected with somebody who is trained in mental health to deal with folks in crisis. And these services are available 24/7. And I will show you right away how to access them. So you just go on Google and you hit crisis line, and I would say Ottawa, and then you hit on the first one, 24/7 crisis line, and then if you do this from your phone, once you tap on this, it will be connected right away. You will be connected right away, like this button will call somebody right away. So you have at least 3 lines here available at your disposal to, if you are in a crisis, in a mental health crisis situation. You call one of them and you will get help immediately right away. If you're not comfortable with calling somebody, you can also chat with them through this button right away, and you'll be connected as well. Some of these lines you can also text with them as well. Here you go. It tells you text. You can text on this number, chat and text from 10 a.m. to 11 p.m. So this is the first thing, the crisis line. The second is short and midterm. This is for folks who maybe don't have access through their employer, or some employer have insufficient mental health services. For example, if an employer is telling you that, or the coverage company is telling you that you're only covered for $500 per year, and the provider's hour, for example, is $190. So you're only covered for almost 3 sessions, because they would tell you that out of this hourly rate, you're covered for 80% of an hourly rate up to $500. Yes, I know all these details can be confusing, but it is the reality. We're hoping and we're advocating to have an easier access for mental health services. You don't need to go through all these coverages to do that, but I'm just trying to clarify it for folks. So some folks who go beyond these coverages and then they end up not having coverages, they can access a short or midterm mental health services through the community and community health and resource centers. And there is a gateway in Ottawa that connects all of these centers together. And I'm going to show you to you here. It's called Counseling Connect. You put it on Google. And you get it the first thing. And you navigate the website, and it will tell you, like, you get started, and then you will get triaged, and they would ask you certain questions, and you would get to know about all these mid and short and midterm programs around Ottawa. So it's like there are all these programs that are geared to folks from different backgrounds to access counseling, mental health counseling services for different ages as well, different languages, etc. And it's very simple. You can also change the language. It's only available in English and French. But some programs, as well as this one here, it says it's available in Arabic. And this program here, it says for First Nations, Inuit, and Métis. So yeah, check it out, the Counseling Connect. It's only available though short and midterm availability. Some of them on the long run, and this is what we will get to. So the long term, very few of the community programs that are publicly funded are available for long-term access. Some employers have really good coverage, or they buy really good coverages, and they can cover beyond these $500 per year to access a provider. But this is a big issue in accessing mental health services, and we need more advocacy for folks who are requiring long-term access to mental health services. All right, there are other services that are online based. They are not necessarily on a session-by-session based, like the traditional services. You book a session, and then you meet with a service provider. An example of this publicly funded service. It's funded by the Ontario government, and it doesn't, as you fill in the form, you need to set up an account, and you're asked certain questions. And after you've been asked certain questions, you would be connected with a mental health trained person, and you might be able to connect with them through maybe texting or through a session or two. But again, it's not a midterm or it's not a short or a mid or a long term. It's mainly providing you with resources, certain articles, some tips on how to take care of your mental health. But it's not the traditional session by session method. It could work for certain folks, but again, it's never as an alternative, or it cannot replace the traditional mental health services where you are connected with session by session mental health providers. Okay. My last thought here, I would be walking you through if somebody wants to get connected, if you have a coverage, or if you have a coverage either through your employer or through the government or a publicly funded coverage, but you want a specific person or a mental health provider who could provide their services in a different language than French or English, or in any language. Some people like to do this too because they find that many people coming from different backgrounds or diverse backgrounds from all over the world, having that language barrier broken. Not necessarily they might be speaking just mainly English, but when we share our vulnerabilities or issues coming from our own diverse cultures, we might need to have somebody who would understand this background, our own background, and instead of just trying to describe to us somebody who's not familiar with such background. So it just can be for some folks more efficient, and it gives them an idea on how to navigate this cultural side of mental health. So I would like to show you here how to, if somebody, or if you want to help somebody, maybe if you have somebody in your family who doesn't speak English or French and want to access somebody who, or a provider, mental health provider, from a different language background or a diverse language background. So for example, we need to search these providers. Just a second. We need to search these providers from a at their own colleges. So for example, if I want to search a provider who is a psychologist, let's check. You need to search the Psychologist College, Ontario. So these are the terminologies that you do: Psychologists College of Ontario, or Psychotherapists College of Ontario, or Social Worker College of Ontario, for example. You hit enter. Usually, and even if you spell this wrong, Google will correct it for you. The College of Psychologists of Ontario. So you click on it. And then usually in most colleges, you would find that the first button, or the most clear or the most obvious button, is you can look up a member in the college. So licensed, like mental health providers are licensed providers, and they are governed by a body which is mainly called colleges. And colleges, one of the things that they do, they have websites that has publicly accessible information about these providers. So what you can do here, so once I got to the College of Psychologists of Ontario, I could write the last name of the provider right away, or I could hit advanced search. And then I don't need even to put the first name or the last name of the provider, but I can put the city. Since here our example is going to be searching a provider, and I'm biased towards Arabic. I work with Arabic clients, and it's part of my heritage. So I would search for the providers who speak Arabic in the city. And I can put the city but even I can put a postal code, so I can find folks who are, or providers who are very close to me. I'm not going to do this again, but this is an option to put your postal code. What I'm going to do here is I'm going to choose Arabic. Also, it can be easier because it's at the very first, or at the
Marcus,
yeah.
I just want to pop in and say we actually only see your Firefox page right now, so not the page you're talking about.
Oh, I'm sorry. I'm not sure why. Let me. Okay. Huh. Okay.
So we see your presentation now.
Okay. What I'm going to do is I'm going to copy this. Put it here. Sorry about that.
So yeah, we can see that now.
Yeah, awesome. So this is the page, and I will get back to, okay. Here. So this is the front page of the College of Psychologists. And then it says like find a member. You hit on advanced search. I'm going to choose Ottawa. And then I would choose Arabic. And then I would hit the search. Search now. So view the providers who speak Arabic who are registered psychologists with the college. What I would like to do, and they will give you the names, where are they working, their phone numbers, emails and stuff like that. So you'll be able to contact them and maybe book an appointment and stuff like that. The last thing, I just want to take a look at the page. Okay, awesome. Another thing that you can do is by searching for psychotherapists. So okay, and then that's the first one. It's the same thing. It's a different college for other mental health providers. And then let's see. Here you would find the public register contain information about CRPO registrants. So you hit on this one, or even from up top, you would hit here from public, find the registered psychotherapists. So either ones, find the registered psychotherapist. So you get transferred to another page. Okay, search by name, last name, registration, or language. Maybe I would say Ottawa and Arabic. Let's see how smart it is. Oh, here you go. So that was very smart and easy. These just changed their interface, and I kind of like it, how easy it is. So here you go. So we got 26 psychotherapists, and you would hit, for example, view, and then you get way more information, like lots of information about them. Where are they practicing? Their phone numbers, etc. So yeah, this has been the examples that I wanted to share with you. Let's see. There has been a question. One question that comes to mind. Some people would ask about what about neurologists, especially with some folks who are from for example, in Arabic, the terminology about healthcare providers, mental health providers, is not as clear. So it can be confused with other terminology. So, for example, neurologists are specialists who work on the nervous body, the nervous system. They are specialists. They are not mental health providers. But yeah, so those are another type of providers that some folks might confuse them with other mental health providers. But yeah, I'm ready if somebody has any questions. I'm done my presentation. I hope that benefited folks. Thank you.
Thank you so much, Marcus. I'm just going to stop the recording and then we'll start taking on some questions.